everyone, and welcome to the VFR hands-on webinar. My name is Kara Moncrief. I'm the Clinical Communications Director for Viora. You guys probably all know that by now. I don't know if I have any new people on today. So you can see my neck is shiny, and that's because I have numbing cream on it. So I put it on 20 minutes ago. So I'm going to talk for about 10 minutes, then we're going to wipe it off, and I'm going to show you guys the hands-on. I just wanted to let you guys know that we do have some upcoming webinars in the next couple weeks where we're going to continue doing this more hands-on. One of them being that I'm going to do a full eye treatment with the VST. We're going to do a plump RF showing you, all the steps on plump RF treatment. We're going to show you contouring the cheekbone with the VST, which is really great. Quick and easy trick to really lift the face and contour the cheekbone. And then we're going to also show you some body contouring, not in the way where I'm hiking up my leg. We're going to do it in a better way. So that's one of them coming up. So I just want to let you guys know if you guys are enjoying these hands-on webinars, because that's usually what most of us need more practice on, or learning in general, is hands-on. That's the biggest questions that we get for sure. So we have those coming up soon. Okay, so I just have a couple people in the chat. Good morning, good morning. Hello, you're looking great. Well, thank you. Thank you so much. I did nothing to my hair today because I knew I'd be getting it out of the way anyway, so thank you so much. Hello, good to see you again. You as well, Giovanna. Thank you guys. Thanks for joining. All right, so we'll start discussing the VFR hands-on. By the way, if you guys can't, if I'm in like a little box and everybody else is in little boxes on your screen, all you have to do is click on, I think it's at the top, click on speaker view. So if I am in a little box with everybody else, then you're in gallery view and you just need to click speaker view. If you guys have any questions during this, I love when you unmute yourselves. That's really nice as I'm doing the treatment, just because my hands will be busy. So it's really nice when you guys just unmute and ask the question, and we can just have a discussion back and forth. I love that. That's my favorite. If you guys don't feel comfortable talking, that's totally fine. You can still write into the chat because I will still be going through the questions in the chat. So, okay, so we'll get started. I'm not going to take the numbing cream off quite yet, but I will pull my hair back just for a bit to get it out of the way while I do this. So I have some supplies here next to me. Baby wipes, you guys know these are my favorite things in the world. It's just quick and easy to remove like makeup if they come in for a treatment and they have makeup on. Sensitive skin, fragrance-free, hypoallergenic, they're not going to have a reaction to it. But this is also great. I used one of these to really wipe my skin down before the numbing cream, and I'm going to use this to wipe off the numbing cream. I have gauze and alcohol nearby because we always alcohol the skin before any VFR treatment, just to make sure that it's very, well, two reasons. One, that it's not sanitary. What's the word I'm looking for? Oh my goodness, drawing a blank this morning. Anyways, the skin is very clean, so we're very safe because the VFR, we are working with, opening the skin. So we want to make sure that we avoid any risk of infection. Sterile, thank you so much. My brain went, all I could think is sanitation. I think that's because that's all we hear on the news is sanitation, sanitation. Sterile, so we are working with very sterile skin. And then additionally, we're removing any oils. If somebody has very oily skin, like myself, the oil can actually create a barrier, and the VFR doesn't have as easy of a time releasing energy into the tissue. That happens a lot with my face. If I alcohol my full face and I do this side of my face and then I go to this side of my face and it's already created this kind of like oil barrier, the VFR will not want to release on the skin sometimes. Then I have to alcohol it. So just making sure you get all the oil off as well. So that's what these are going to be for. That's what the alcohol and gauze is for. We are always wearing gloves during the VFR treatments. That's very important. So I have gloves nearby here. And then, oh, I don't have a little table, so everything's on the floor, unfortunately. Okay, so I got my gloves, and then I'll just put those there. We have the VFR tips. So those of you guys that know, in the US, you guys are part of an IRB study, right? Because the VFR is not yet FDA approved. If you are joining us from overseas, that is not the case. You guys have had the VFR for years. You're very lucky because it is the most phenomenal handpiece, I think, in the market, just because it does so many great things, which we discussed on a previous webinar. So with the IRB study, you get a certain amount of tips, and that is, we give you more than you're needing to really conduct the full study. So I have my box of tips here, and I'll pull one out and we'll discuss how to put the tip on properly. All right, I'm actually, well, usually I do, but then I'll have to take my gloves off again. But when you're dealing with the tip, make sure you put your gloves on. But I don't want to have to dig out another pair, and I still have to remove this numbing cream, but that's what you would typically do. So what I like to do is when I open the tip, I would have gloves on typically, but it's just myself, so I don't have to worry about working on somebody else, right? I open it to right there. I don't pull it all the way off. Reason being is the tips are reusable. So each tip is 600 pulses. I'm going to really make sure not to touch this though, because I don't want to touch that with my bare hand. But each tip is 600 pulses. So that's about 2 full faces, sometimes 1.5, depending on how much coverage you do. And it would be about 2 to 3 full necks, which we're going to do today is the neck. So when you just open it to right there, then when you're done using it, you can put it back in, and then I tape it all the way around, and then you can write their name right here. And then I like to put it in a sealed baggie additionally. So I seal it around with tape, and then I put it in a sealed baggie, so we really make sure we're keeping the actual tip sterile as well. And I'm going to be talking about how I use a toothbrush, and I put their toothbrush in that baggie. So it's their toothbrush, it's their tip, seal the baggie up, and then you can put their name on the outside of that baggie. So that's how you're going to open it. And then how you put it on. So this is your electrodes and your cooling plate. And then these little knobs here and here, those are the vacuum. That's what controls the vacuum. So you can see that we have 2 little holes here for where the vacuum comes out, and that's where you line it up. And then I'm just going to take a glove and I'm going to push on it. So you kind of have to give it a good push for it to click. Don't be too dainty with it. You're not going to break it. I mean, don't be crazy with it, but sometimes you just need a little push to get it to click in. And I don't know if you heard that. So I just worked the side until I heard that click. But another good way of knowing is it properly on. Is it going to register that? There we go. This is all clear plastic, which is great. So you can see that it's properly on here. If it wasn't on, you would be able to actually see that it wasn't. It looks kind of, it would be obvious that it was off right here. So make sure that that all is lined up. And that, let's see if that registers. Nope, just this side. And then make sure that you really don't have a gap here or a space here, and then you know it's properly on. You really want to take your time with that and not just kind of pop it on and go and not look. Reason being is we need everything flat for multiple reasons. 1, for that vacuum to activate. 2, for the cooling plate to properly cool, but moreover, for all of these pins to fire properly on the skin. So if it's partially on, partially off, we could get an issue with really how the RF is delivering into the tissue. And you don't want that, because remember, with RF energy, it's a positive to a negative delivery with your electrodes. So if it breaks that contact, you can create blisters, right? So, I mean, our handpiece is still safe. Like, it's most likely going to say it's not on properly, but you know, just in case you want to take that time. All right, so let me see what time it is because I don't want to take my numbing cream off too soon. I'm a baby. Okay, it's perfect. It's been 30 minutes. So, and by the way, if you guys ever wonder, like, what kind of numbing cream should I get? This one I love. There's so many good ones out there, but you have to make sure. You may have really good high percentages of numbing cream, but the actual material that it's made of, the actual cream, may not be all that great. So then you're thinking, well, I have really high percentage of benzocaine or tetracaine or lidocaine, but it doesn't work all that well. That's what it could be, is just the consistency, maybe how viscous the cream is, where it's not really properly absorbing into the tissue to really numb the skin. So make sure that you're ordering a good one when it comes to that as well. This one I love. It is lidocaine, tetracaine, and prilocaine. And it is 23% lidocaine. It is 7% tetracaine. And it is 2.5% prilocaine. And it is a phenomenal one, to the point where you really can't feel anything. There's other ones too, like BTL. It doesn't have to be prilocaine. It can be benzocaine, tetracaine, and lidocaine. BTL, a good one would be 23.7. So 20%, 3%, and 7%. I believe it's 20% benzocaine, 7% tetracaine, and 3% lidocaine. So if other people just have advice on, you guys have amazing numbing creams as well, go ahead and write it in the chat so we can all learn from that. And so we all know which ones to order. But this one is phenomenal. So again, I'll repeat that. It's 23% lidocaine, 7% tetracaine, and 2.5% prilocaine. Really good one. All right, let's see, we have chat. Someone probably is writing in about that. Please give proper spelling for numbing cream. The cream you are using name. Oh, it's from a compound pharmacy. And I mean, there's no like specific brand. It's just the specialty pharmacy has a name, and it's Partel. That might be a Las Nevada thing. I'm not positive, but Partel, P-A-R-T-E-L-L, Specialty Pharmacy, Compounding Professionals. That's the name of where we order it from. But that's just, again, that's just the pharmacy. So I don't know if that makes a difference, like in your area. But again, it's lidocaine, tetracaine, and prilocaine. So those are the three. It's really good. They have good BTLs though as well. And anybody else want to write in anything that they use, or maybe online pharmacies that they know of, so on and so forth. So I know, I mean, it needs a doctor's prescription to order them. I'm lucky, my family's in medical, so I'm lucky with being able to get this. But you guys have medical directors as well. You may be the physician, so just find a good compound pharmacy that uses good ingredients. Okay, so I'm going to now take off the numbing cream. Put my hair back again. So first I'll do a baby wipe. I just need to use a thin layer of this numbing cream just because it's so good. I like to massage it in for a little bit, you know, wearing a glove and rub it in for a few minutes because it just activates sooner. But better than that is doing a microderm before you do your numbing cream, because you can just imagine how well it penetrates into the skin and how well it numbs when you use microderm beforehand. So that's always my go-to is microderm, then numbing cream. Then you don't have to massage at all. It's penetrating deeper than if you didn't do the microderm. Plus you're increasing circulation, you're removing dead skin cells before the treatment. So it's a positive all the way around. I did not have time to do that today though, unfortunately. So I just massaged it for a bit. Oof, can't feel my jaw, it's so weird. If you're doing labia treatments, by the way, we're trying to figure out how to do labia treatments for you guys. So if we figure that out, we're thinking maybe getting like a medical doll and doing it for you guys that way. So we're looking into that because I know so many of you guys want to know how to do Revive. But if you're using the numbing cream on the labia, it is so numb just because of that mucosa tissue. It's kind of like when you put numbing cream on your face, what's the first thing that goes numb? And what is the most numb on your face? It's your lips. And it's just because of this tissue, same tissue in the labia. So it's great for their comfort if you're doing VFR in the labia because they really, really are numb well. Just really want to make sure I get this off. Okay, now we're going to use alcohol. So you guys know things are already starting to drop. Oh, it's my iced tea. I wanted that nearby. No, it's like rolled on the floor. You guys know my love for spray bottles, so it's alcohol in here. Just so nice and easy to be able to spray a piece of gauze down. You guys know my love of 4x4 non-woven gauze. You guys have been joining all the webinars. I'm sure you guys have. Okay, so now we're gonna alcohol the area. If you're alcoholing the face, and you need to go around the mouth and the nose. Alcohol's so strong, right? 70% alcohol, that's all you need. I have them take a deep breath, hold it, do the nose, air it off for them, and then let them breathe for a second. Then take another deep breath, go around the mouth, quickly, air it out, and then let them breathe. Otherwise, that's what chokes them, you know, that's kind of the most irritating thing of the whole treatment sometimes. It's just that alcohol. Eyes, like around the eyes, just have them keep their eyes shut because some people want to keep their eyes open and their eyes are watering and burning and they're suffering. Don't do that. Just have them closed. I don't know how far I went back with this numbing cream. Just kind of slathered it on here to my hair and everywhere else. I think I came down kind of far too. This is great too if anybody has like any residual spray tan or something, which I do. I take the spray tan and I put it, I have a sprayer, like a little gun sprayer at home. When I spray it into my hand, I just put it on my face just because I'm so pale. Sometimes it gets down into my submental area. We want that off, so this will remove that residual spray. That's also a great trick with like IPL treatments. If they spray tanned and it's been like 7 days, so it's almost off, and they want to get their treatment done, to just alcohol or take alcohol and gauze and alcohol the area and just get that residual spray tan off for them. Now, if it's like 2 days into the spray tan, I mean, you'd be sitting there all day scrubbing their skin off with alcohol. Don't do that. But if it's just a tiny bit left over. All right, so now, by the way, this is probably gonna be our shortest webinar. I know I always say that, like, this is probably gonna be an hour. And then I talk for 3 hours. You're probably like, you're lying. It really will be, because there's only so much to show today. It was soft gauze. Well, it's, yeah, soft gauze, but if you're going to order it, it's 4x4 non-woven, and this is the brand that we, woo, I'm rolling around, that we use. Soft gauze, soft fiber blend, large, it's called large silken wipes, 4x4. I don't know how to say that, but there's the name. Soft fiber blend, yes. I love these. These are great. All right, so here's kind of actually annoying me with it back, so I'm just gonna do that. All right, so I also want to make sure that I have a toothbrush nearby. I'll explain that in just a bit. We'll log in. All right, so I'm gonna treat the neck, and I don't have scarring, I don't have anything like that. I actually typically do my neck. I only do it once or twice a year just to, I hate when people really just focus on their face, which I was a culprit of this, but really just focus on their face and they forget about maybe their décolleté and their neck. And the problem with that, why I say I hate when that happens, is the problem with that is their face may look, you know, 40 when they're 60, but your eye immediately goes to their neck and their décolleté because maybe it's really lax and loose and crepey. And then they could have done as much as they could have for their face to really make them look great, but our eye doesn't even really see the beauty of the face. It kind of goes straight to the laxity on the neck. So I would just always recommend that too within your offices and your practices. If you have females that are just wanting to focus on their face and you start to see the age of the neck, talk to them about that, you know, because when they get to a certain age, they're going to wish that you probably would have. So I make sure to do that. For my neck, a VFR is great just to really maintain the collagen, keep the neck tight, and I do have laxity like in the submental because I'm going to be 40 next year. This has stayed pretty tight though, but I just make sure to really do preventative measures as well. All right, so I have an option between shallow, medium, and deep. Remember, shallow is epidermis, medium is papillary dermis, deep is reticular dermis. Typically, for the neck, we're not typically working shallow. Epidermal, unless somebody has like a lot of sun damage and you want to use the VFR for ablation for sun damage. Or just overall just textural issues, but usually people on the neck, it's not just textural issues, it's also laxity. There's laxity involved. Where we know how to treat laxity is going to be it's going to be deeper than the epidermis, right? We can't just work the epidermis for tightening. We need to get into those collagen and elastin layers. So kind of a rule of thumb, if they're, I want to say much older, but that's not even the case sometimes. Sometimes women or men in their 50s can have really deep lines and a lot of laxity in that area. So if that's the case, you're going to want to treat deep. If you're really seeing deep set lines, then they're most likely reaching all the way to the reticular dermis. For me, sure, I have lines, but they're not like super deep. I don't have a ton of laxity. So I'm going to treat myself at the papillary dermis, medium. All right, so now I have an option between 10 and 100 milliseconds. Just as a review, remember that between 10 and 50 milliseconds, that's just going to give more of an ablative response. I don't want that because I'm not needing just ablation, right? I want to target tightening. So between 80 and 100 milliseconds is going to be tightening. And then just as a reminder, if you meet those two in the middle, so between 55 milliseconds and 75 milliseconds, you're going to get ablation and coagulation. If you're closer to the 50 range, it's going to be more ablation and a little bit of coagulation. You're closer to the 80 range, if you're like 70, 75, you're getting a little bit of ablation and a lot of coagulation. So kind of assess here. Now, I do have textural issues because of my poikiloderma. If you guys were on with us last week, you saw that I treated the poikiloderma. Still very red because remember, on the body, it takes about 3 weeks for it to really go through the healing process. Same thing with the VFR. I'm gonna be healing for about 3 weeks. So it doesn't matter, I'm just doing webinars with you guys and we're in this industry, so you understand. So with the poikiloderma, it's not just here where it's red, it also kind of comes up on my neck a bit. So I do have that bit of rough texture down here. Not here, it's smooth, but even with my gloves on, I can feel it smooth, 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 rough. Right about that line, it starts to kind of get some textural issues there. So because of that, I'm okay with getting a little ablation. I don't necessarily know if I want that to really have matrix marks on my skin for the next 3 weeks. So I would rather kind of try to avoid that for me personally, because my main concern is going to be tightening. So I'm going to treat it at, trying to think if I want ablation. If I really wanted to avoid any ablation, I would treat it at 100 milliseconds, just straight coagulation and just straight collagen elastin. But I'm going to take a little chance here, and I'm going to do 80 milliseconds. It's still going to give probably just more coagulation in general, but we'll see. Okay, so, and you're going to get those type of patients, you know, that they come in and they don't want that downtime. They don't want to have the marks on their skin for a week or 2 weeks or sometimes 3 weeks if it's on the body. And you can control that, which is amazing. You know, you can keep that pulse duration really long at the 100 millisecond and keep your energy lower. Just make sure you don't smell burnt skin. As soon as you smell burnt skin, even at 100 milliseconds, if your energy was a bit too high, then you're gonna get into ablation. So it's nice that you have that controllability. Now, sometimes they just, it doesn't matter, they just need it, like scarring, stretch marks, scars, it needs some ablation. Acne scarring needs some ablation. So, you know, it is what it is. They need it to get the result. Now, if they're in the middle of their series and you're doing acne scarring, and they said, hey, listen, I just was asked out on a date. I'm really excited, but you know, I can't go if my face is marked. Okay, let's be more conservative with this one treatment. Treat them at 100 milliseconds, keep the energy lower. And then the next time they come in, you can get back into that ablative mode. So that's okay too. All right, so I'm gonna keep the smart heat on. Remember, the smart heat is the 1 joule of energy that delivers before all of the electrodes release their energy. So it's just helping to warm the tissue so I get better depth of penetration. We'll keep that on because I want to get that depth of penetration. Keep the vacuum on for comfort and also safety. So absolutely. Cooling, yes, I always keep cooling on, always, even when I'm just doing ablation, because it's just keeping it more fractionated. When that whole, if you see here, that whole kind of like green area, that's all the cooling plate. So it's surrounding every one of those electrodes. So when you keep that on, we're making sure to cool the skin surrounding the electrodes. So really only fractions of the skin are treated. Even if you turn off the cooling plate, it's still going to be fractionated, but it's just that extra bit of safety of keeping the surrounding tissue safe. Also comfort, because this isn't the most comfortable thing in the world when you're doing ablation. Even with numbing cream, you know, sometimes they can have that discomfort. All right, so we will start out. The lowest energy we can start for testing is going to be, sorry, I'm moving my eye. I'm making sure I'm using the back of my glove. The lowest energy that we can start out at is 1 joule of energy. Oh, bothering me, sorry guys. And that's where we'll start for testing. So I'm going to turn it on. I don't know if you guys can hear that. I don't know where the speakers are. You probably can't hear that. But you're going to hear the vacuum, so you'll know that it's on that way. Additionally, you're going to see a blue flashing light. That is when it's on. So if you ever question, is this thing on? Okay, so we're going to start. Oh gosh, this is going to be difficult. Let me see if I have my mirror here. Oh, I do, thank goodness. Okay. So I'm going to start here on the side. Remember, always test on the side of the face, on the side of the neck, really in areas that are harder to see. I'm going to try to get closer to. Pull my computer closer as well. Really up close and personal here. All right, so make sure the mirror is out of the screen so you guys can see. Okay, so you know what? I'm not going to start on the side just because of the webinar. Typically I would, but so you guys can really see, we'll start right about here. Okay, I'm going to put down good pressure, really push, because that keeps them more comfortable too. And then release. You hear the beep, then you're able to move. So do not move this during the activation because you'll break the positive to negative delivery and you'll create a blister on them. So there's two things. You'll listen for the chirp, you'll listen to the vacuum, and this blue light will become solid blue during the pulse, and then it will start blinking blue when it's done. Okay, so I'm gonna first find my energy, and then I'm gonna talk to you guys about the treatment, like how to overlap and all of that. So you would take this off and really assess the area, make sure everything looks good. Then if everything looks great, if they were comfortable, then you're gonna go up to 1.25. I know my skin, I don't have to do all of that, and it would take a lot of time on this webinar, a lot of boring time. So, but you would stop, take about a minute, look at the area. Does it look normal? Were they comfortable? Were they in agony for some reason? Why? Is it hiving up, or looks like it's you burnt them, or there's some type of reaction that's not normal? These are things that you need to look for before you really crank up the energy too high. Okay, so that was 1.25. Now I went up to 1.50. Again, I would stop, assess. Again, I'll talk about how I'm overlapping what I'm doing in just a second. Okay, that was 1.75. I can feel it, but I really can't. Oh, I keep trying to do that on the video camera, and I can't do that. I'm so sad that my mirror broke, because otherwise it could just be sitting up, but it broke, like the mirror from the stand broke, unfortunately. Okay, 2.25. Starting to feel it now. I cannot go up very high on the neck, me personally, and just the overall comfort of it. And a lot of your patients will be that way because neck is a sensitive area. And that's okay. Like I said on the didactic, don't think that 2 joules of energy is really low. It's not. With this handpiece, 2 joules of energy is still quite a bit of energy. So it's not like you have to crank it up to get a result. You don't. I'm at 3 joules now. I don't know if you guys can hear things very well, but if you could, that vacuum sounded different. And it's because the vacuum wasn't able to properly couple in the tissue. So the vacuum really wasn't strong on that last pulse. So if you ever hear that, like the vacuum doesn't sound quite right, what I like to do is just kind of adjust it just a bit. So if I was like this and I hear the vacuum soft, just quickly adjust. And then as soon as you hear it kind of suck in and you hear the vacuum activate, perfect. And it doesn't have to be a dramatic movement. It just can be just a kind of a gentle rock. And then usually, especially areas that are like bony and curved, sometimes you just have to kind of maneuver it just a bit, not coming off the skin in any way, but just maneuver it just a bit to get that vacuum to activate. I see questions coming in. Do you guys want to unmute yourselves? Can you unmute yourselves? I think I made it so you could. Okay, that was 3.25. I'm starting to feel that. If you guys have had this treatment done, you'll know what I'm referring to. Ooh, boy. Okay, 3.5. I don't know if I'm gonna be able to go higher than that. I don't even know if I can stay at 3.5. Let's see. No, that wasn't too bad. Maybe it was just that area. Hi.
Hi, Kara. When you're doing the neck, is it the same parameters for the thyroid as it would be with radio frequency? So you don't do the thyroid and you do the same technique about pulling the skin over?
Yeah, exactly. Because it's radio frequency. Because it goes deep.
Yeah. Thank you.
Yeah, you're welcome. Thank you for unmuting. All right, so I think I found my energy. Now, if I question, am I getting into ablation and I didn't want to, there's 2 ways you can find out. 1, you could smell my neck, or sounds funny, or 2, you can smell the handpiece. And I do. I have a tiny bit of burnt skin smell. So it is going to get a little ablative, which is I'm fine with. I don't want crazy ablation and have it for too long, like 3 weeks, but a little bit of ablation, and you can see a little bit of redness going on. Who knows how my rows are going to look doing it on a webinar instead of just doing it on somebody, so we'll see how this goes. Okay, so now we'll talk about overlapping and your actual technique. So I'm going to try to pull this really close without my computer falling off. Okay, I think that's good. All right, so I wish, can I prop up the mirror maybe like right here? I don't want to hit any like, oh, I'm already hitting buttons on the computer. Give me a second here. Let me try to figure this out. Okay, that's working. I think we're good. All right, so now how do you get a really tight overlap of your rows, and how do you get a tight overlap of each pulse? So I just finished that row. Who knows if it's crooked or not? Yes, a bit. Sorry, guys. So now to get a tight overlap of my next row, what I'm going to do is I'm going to put it half into the red. So I can see that it's the size of the tip, this whole red row. And sideways, I'm going to put it half into the red, which is right about there. Where did I start? I think I started lower. I'm going to go down on this one just because I'm not red down here where my energy was lower, so I can't tell. So I'm going to start at the top here. Sorry, I probably shouldn't have worn earrings. Okay, I'm going to put it half. No, never mind. I changed my mind. I want to work up. So I'm going to put it half in the red right here, and then I'm going to roll it over. Good pressure. Doesn't hurt down there at all. Maybe I'll go to 4. I'll see if I can do it. Now, you're never just lifting off the skin and putting it back down, because how do you know you're getting an overlap? They'll end up being stamped everywhere. In the workbook, it will say to go off of the vacuum marks, but you'll end up gapping. So the best way to do it is, so I just pulsed right there. You're going to roll it to the side, and I can see. And another thing, sorry guys, another thing is, remember, it's kind of deceiving. The only thing that's treating the skin is just right there in the center, just those tiny electrodes. Ignore the smart heat. That's just helping you during the treatment. It's not actually treating the skin. So you're going to ignore the smart heat. You're going to ignore the vacuum and all the plastic surrounding it. So to get a tight overlap, you're actually going to feel like, oh my gosh, I'm probably overlapping by 50%, but you're not. You're probably still gapping at that point. So it really takes a few treatments of doing this technique to really get a great overlap. So don't be hard on yourself. Okay, so what I'm going to do is I just pulsed right there. So I'm going to roll it to the side, and I'll be able to see only just that small bit of skin right there between, I can see in between, right? Just that small bit of skin was treated. So I'm only going to move up that much. That's an overlap. Roll it back over. I'm okay at 4 joules. Roll it to the side. I always steady it with a hand. That's it. Roll it over. Anybody have any questions? Woof. I don't know if I'm able to stay at 4. I may have lied. Okay, so it just stopped me. So that it allowed me to go up to 20 pulses, and it stopped. And it gives a ding, and it says, please stop treatment and clean VFR tip of any debris that may affect the treatment. What does that mean? It means that the little electrodes here start to gather dead skin cells. If you ignore that, if you just hit okay, don't do anything to the tip and keep going, that's when you start to get superficial burns, and it could be blisters and not controlled energy, thermal injury, but not controlled thermal injury, actual blisters. So, or burns. What you're gonna do is, with the handpiece, we give you, I wish I had it nearby, but you guys know what it looks like. It's just that little black brush, and that is what's, we send you, oh, I can't talk right now. This is what we send you to clean the tip. For me, it's hard to really scrub the tip with that. So I love toothbrushes. You can go on Amazon and order a huge bulk of toothbrushes for very cheap. And then you can just use one toothbrush per patient. So you'll have that spray bottle of alcohol. Another reason why you need the spray bottle of alcohol. And you can spray it down if it's hard to get the debris off. And that really is the only time that you'll get into that is when you're in high ablation. And that's when the skin cells are kind of sticky and they start to stick really around the electrodes. So if you take a dry toothbrush, and that's what I'm going to do because I'm not in high ablation, so I don't need to wet it with alcohol. If you take a dry toothbrush and really scrub it, don't be afraid of scrubbing it, because you really want to get all those dead skin cells off. And the toothbrushes are, you know, soft enough that it's not going to do anything bad to the tip. So I'll give it a good scrub. Then I'll look at it. I want to make sure that it looks perfectly clean. I want to make sure that all of those electrodes look very gold, and that the cooling plate I can still see is green underneath it. If it's dirty, you'll know. You'll be able to see, like, some of these electrodes would look actually dirty and brown, and you would be able to really see that it needs more cleaning than just the dry toothbrush. So when that's the case, you'll just take your bottle of alcohol. Don't spray the tip, but spray the toothbrush, and you'll just get it damp. And then you'll go in and scrub it. I didn't need to do this, but I just wanted to show you guys. Then you'll scrub it, and that's what will get the rest of that debris, those dead skin cells, off of the tip. Alcohol dries really fast, which is great. However, you do want to make sure it's dry before you pulse with RF energy and alcohol. So just make sure that that's nice and dry before you begin. Okay, so that's going to happen every 20 pulses. Never ignore it. Always scrub, look, go. All right, so turn it back on.